Hi, I'm Laura. I'm a student nurse.
Hi, nice to meet you, Laura.
Can you give me the SBAR report on this patient, please?
Sure. Okay, so in room 622, we have Ronald Jarvis. He prefers Ronnie, okay? He's 171 pounds, male, 67, 5'11". He doesn't have any known allergies. His BMI is 23.9, and his doctor is Dr. Phillips. Then some of his background. He's been a diabetic for 20 years, type 1 diabetes. He's had elevated blood glucose for the past 5 days. It's been in the 300s. So he went to his doctor to have that checked out. Within the last 3 weeks before that, his blood glucose was normal, around 120. His A1C was 5.6 3 months ago, which means that he's been having good blood glucose control. And he was admitted for glucose control. He has a diabetic ulcer on his right heel and for some pain management for that heel. So my assessment, he's alert, oriented. His last pain was a 1. Before that, it was a 6. So the morphine sulfate that we're administering is working. The head to toe was unremarkable, besides the injury on the pressure ulcer on his right heel. He has neuropathy in his feet, so he really doesn't feel anything unless it's a painful stimulus. So we just want to look over the area, teach him about care for his feet so that he doesn't cause more injury. Vital signs 128/70 for his blood pressure. His heart rate was 76. His respirations 16, oxygen 92, and his temperature was, oxygen was 96. Temperature was 94. I'll have to double check on that. And his blood glucose was 242, which you'll learn in level 2 is too high. His output was 320, and then all of his labs were within normal limits for his age and situation. He does have an IV line in his right median vein, and he's fall risk, and then he has a Braden score of 18, so he's at risk, so we just want to make sure that we turn him every 2 hours.
That's a great assessment.
Thank you. I did recommend it. Okay, so we want to turn him every 2 hours. Activity as tolerated. He bowls once a week, so we want to try to increase that. We want to continue monitoring his vital signs, obviously the blood glucose, and administer the sliding scale insulin as needed. We're going in, he's about to fall asleep, so we're just going to be administering the gLARGine. We also want to monitor that pain and administer the morphine PRN. And note the ulcer, any changes, odor, drainage. And then he came in wanting to learn about his a diabetic diet and some exercise. So we'll teach him about that when we get in there.
Sounds good. Why specifically are you giving this client? What is the name of the medicine? Lantus?
Yes, gLARGine is the it's the other name. So he's a diabetic, so his body does not produce the insulin that he needs, so his blood sugar spikes up. gLARGine is a basal insulin, so it kind of keeps him steady throughout the day, and then he takes a bolus after or with meals as his blood sugar peaks. But we're administering the gLARGine to kind of keep a lower level of the blood sugar for 24 hours.
So what kind of action does that medication have on the body?
Since he's diabetic, his blood sugar is really high, so the medicine is going to help lower that blood sugar, basically increases the uptake of glucose by the cells.
And when should we question administering this medication?
Well, since it's to lower the blood sugar, we want to check the blood sugar. So if it's too low, we're not going to want to administer it then. We also want to see how much he's eaten during the day. If he hasn't eaten all day, that might be something that we would consider, want to change, adjust. And if he's had a ton of exercise, or if he's severely sick or has an infection, we're going to want to take another look at the amount we're giving.
Does this medication have a therapeutic serum level?
No, but we're basically looking for a purpose of maintaining blood glucose between 70 and 120.
Which vital signs must be monitored?
So we want to monitor his respirations, his heart rate, his O2, if he has Kussmaul's breathing or high respirations for hyperglycemia, then his oxygen is going to fall as well. And we'll also want to, again, monitor the blood glucose.
Which physiological parameters should be monitored when the medication is being administered?
Okay, when it's being administered, we just want to make sure that he's not hypoglycemic. So check to see if he's sweating. That would be a sign. If he's cold. If he is shaky.
What interventions must be taught to the client to ensure this medication is administered safely in the hospital setting?
Well, in the hospital and at home, it's going to be relatively similar. We're just going to have a better control, better eye of it in the hospital as we're documenting everything. But we just want to make sure that he rotates the injection site, that he's testing his blood glucose regularly, and that I think that's good.
Okay, are we ready to go give him his medication now?
Yes.
Okay, let's go inside.
Hello? Hi, Ronnie. My name's Shelby. I'm going to be your nurse today. I have a student following me. This is Laura.
Hi.
So we are going to, you're getting ready for bed, correct? Mm-hmm. Okay, so we are going to administer your gLARGine, your long-lasting insulin.
Okay.
So can I have your name and age?
Ronald, Jarvis, I'm 67.
Okay. All right. Let's get your medicine.
I'm glad you made it. You can't barely agree on the video, but that probably helps.
Okay. So since this is a high-risk medication, we just want to double-check the MAR, the medication. We have the route, the date. So the expiration date is good. It's clear, which is good because this isn't a cloudy. This isn't normal insulin. So we're just going to click on the medicine here.
No class.
Okay, we're going to scan your, so we have 18 units insulin. gLARGine Lantus, good. Time 2200. So yeah, as long as we administer within the hour that it's scheduled, then we are good to go. Okay. So let's scan you in. Let me try that one more time. Sorry, Ronnie. Okay, great. Medication barcode. I'm just going to double check that again. And can you just give me your name and age again?
Ronald, Jarvis, 67.
Okay.
I'm so young.
You are. So much left. Okay, so
I
it says.
still will, you know.
Oh yeah, Fridays, right? Okay. So we're gonna actually, we'll talk about your diet and nutrition later. So proceed without barcode scanner. You don't ever want to click that. But so it turned green to show that it's verified. So we are good to go. So what are we gonna do before we pull out the insulin? Do you know yet? Have you guys talked about that?
No, I'm level 1.
Okay, so we're actually gonna, we're going to drop 18 units of air because he's gonna need 18 units of the insulin. And then we're gonna inject that into the insulin medicine itself, and then it'll create pressure so that we can pull out the 18 units. Okay,
Interesting.
double check again. It is, no, it doesn't read without my fingers. Hungry?
A little bit.
Okay. Stomach's making all crazy noises.
I went to this Hawaiian party. Do you like my necklace?
I do. I like your bear too. I love Shelby.
Yeah, she's pretty cool.
Okay. So we're going to draw up, oh, take that off, sorry. We're going to draw up 18, 15, 16, 17, 18. Okay.
Does that in between the 15 and the 20?
Yes. Okay, so I cleaned out the top of that. taken it and checked the air. Okay, when you do this, what do you want to make sure when you're pulling out the insulin?
There's no air bubbles?
Good. So then we're going to drop that 18. Perfect. I'm getting good at this. No air bubbles. Okay. Then we're going to clean the site. Okay. You want to use your stomach because it has the fastest absorption. And then if you are going to go bowling, you're using your arm and your legs. So we don't want to do that because in those areas, because it will absorb faster. Okay, I'm not going to recap that. We're just going to put it right in there. So yeah, so since you've used the stomach for the last couple of days, we're going to keep in that area. If you, after a week, you want to change sites, so the back of your arm, your thigh. Let's see, it's 21:45. All right, so it says you're on a diet now for calories. Things you also want to pay attention to is you don't want to eat a totally high protein diet. You want to have about 50 to 60 grams of carbohydrates per meal. You want to keep your saturated fats below or around 7%. And then your fiber and protein intake shouldn't really differ from a non-diabetic. So about 25 to 30 grams of fiber a day. And then you mentioned earlier that you are a bowler. So that is great. Bowling is actually considered a moderate activity. But what we want to do is I would increase maybe to try bowling 5 times a week or go for a walk the other 4 nights that you're not
That's a lot of
bowling.
pins to get down.
Yes, that is. Have you ever bowled a turkey?
Yes, I have.
Okay, good. I've done it once. Okay, so I think that's it. Do you have any other questions for me?
Can you find someone to sew my bear together?
Actually, that's a Vermont teddy bear. You can send it back to the, they have a teddy bear hospital, and they'll actually fix it for free. You just have to pay for shipping.
Thank you so much. You're so informative.
Yes, okay.
Thank you, Nurse Shelby. You've been great.
No problem. Okay. Do you have any questions for the client?
Not for the client, no, just a couple for you.
Okay, so we're gonna get out of your way. Let me lower your bed. Housekeeping.
Your sheet's all messed up, hun.
Okay, and then your call light is. Oh, it's under the sheets.
Right here.
Okay.
I got it. Thank you so much.
It is
Okay.
right here too. You can hit the nurse button on the side of the
Okay.
Okay. So, do you have any more questions for me?
Were there any pertinent pieces of information you reviewed before administering the client the medication?
Well, again, obviously the big one is the blood glucose. So we checked that. It was high, I believe, at 242. So we want to lower that, so that's good. If it was too low, we wouldn't administer that. Checked her chart. She did have a little bit of physical activity, but he ate his meals. He's 171 pounds, so not especially large, but not small either. You want to put the needle in about 45 to 90 degree angle when you're administering it, and about at least 2 inches away from the belly button. But yeah, blood glucose, his blood pressure was within normal limits.
Did this information affect your decision to administer the medication?
No, I mean, the cause why he's getting the medicine is because of his high blood sugar, and he had high blood sugar, so it just kind of confirmed that I need to administer the medicine.
Did any information affect how you administered the medication?
No, Lantus is actually only administered sub-Q, so I just delivered it sub-Q as it was administered. Again, I checked the patient, the route, the dose, the date, the time. So yeah, so I checked all of those things. I may not have verbalized it, but I checked all those things in the chart. And yeah, otherwise I wouldn't have changed the administration.
Very good, Nurse Shelby. You've been very helpful.
Thank you. It was a pleasure having you follow along today.
Thanks.